Even though so many babies are born every single year by C-section, there is still this massive black hole of information surrounding what you can actually expect during or after your C-section. So stick around, I got 9 things I bet you didn't know. I'm Tina B. Let's not delay, let's get right into the meat of this one. The first thing I want you to know right off the top is that you can't drive following your surgery for at least 2 weeks. Now, that makes 0 sense. Like, let's be real. You just had a baby, you have places to go, you have things to do, so why now can you not drive? There's a couple of reasons for this one. The first reason is that you've just had major abdominal surgery. It's expected that you're going to be on some sort of pain medication. Now, I'm going to give you a heads up here. You're likely going to be discharged with only Tylenol and Advil, but I urge you, if you are having more pain, either in the hospital or when you're getting ready to be discharged, please ask for something stronger. But that said, it is not safe to drive a motor vehicle while you are under the influence of opioid medication. So that's kind of the first reason that maybe you shouldn't be driving. But the next reason is something you might not think about. But when you're driving a car, you do so many little movements and manipulations that you don't even think about to safely operate that motor vehicle. Things like putting your seatbelt on, or shoulder checking for another car, or taking your foot off of the gas and onto the brake, or the other way around. All of those movements, if you have had major abdominal surgery, are going to be really painful, and that sudden increase in pain while you're driving a car can be really dangerous. So, no driving for you. The second thing to be aware of is that your scar and the skin around your scar, it could be numb, and it could be numb for a really long time. And that is because when they do your operation, they're cutting into a layer of the skin called the dermis. The dermis is really packed with blood vessels and nerves, so when they cut into that skin, you can cue the numbness. Now, that's not to say that your scar is going to be numb forever. This tissue is replaced by a fibrous tissue called scar tissue, but the scar tissue, it doesn't have nerves in it. But our bodies are really cool, and eventually nerve endings may find their way to each other through that scar tissue, and you may regain some feeling in the area around your scar. The next thing I really think you should be aware of is that you might have pain in your shoulder. Okay, why, if you have major abdominal surgery, do some people report that they have pain after in their shoulders? Well, this is known as referred pain. Isn't that special? And it's more common with a general surgery, so if you're put to sleep, than with a spinal anesthetic, but it can still totally happen if you have a spinal. And they say that right shoulder pain is more common than left shoulder pain. But why does this happen? Well, it happens because when you are having surgery, you get an accumulation of gas and other irritants in your abdomen, things like amniotic fluid or blood. And all of those irritants, they push up on nerves, and those nerves, they send a signal in a pathway that presents as pain in your shoulder. Anything that's going to reduce the amount of gas in your belly should help with the shoulder pain. I know that those things don't sound like they go together. So things like moving around as early as you can, and anti-gas medications, making sure you are on top of your pain so that you can get up and moving to help that gas. Staying on top of constipation really helps. And sometimes people say that flavored teas, like peppermint teas, it helps a little bit, though that one only has anecdotal evidence and not scientifically backed. The fourth thing on my list is that you're still gonna bleed vaginally even though a baby did not come out of your vagina. I am sorry to bring this news to you if you didn't know, but yes, it's true. You're still going to have an afterbirth flow. This is because when you have a C-section, you are still birthing your baby, and after your baby comes out, that placenta still has to follow. And when the placenta comes off of the uterine wall to be delivered, it leaves behind an open wound, and your body knows that that wound needs to start healing. And the way that it starts healing is that your uterus kicks back into gear, and it clamps and contracts down around that wound and starts to shrink down to its pre-pregnancy size. And when this clamping and contracting by your uterus happens, that is when you are going to start to have the flow out of your vagina. We are more than halfway. C-section tidbit number 5, you might shake following your operation. Now, this is a totally normal response, although for you it's going to be a little bit distressing, probably a little bit uncomfortable, and a lot annoying, but be assured it is very normal. Now, why would this be happening? Well, the medications that they give you in the operating room themselves can cause a lot of shaking. And then if you think about it, you have had an adrenaline release, you've had a hormone shift, and you've had a stress response, all from having a baby plus having major abdominal surgery. So those things in themselves can cause some major shakes in the human body. And then if we have to give you any medications for bleeding post-operatively, those can cause some pretty bad shakes as well. The one I'm thinking about is Cytotec. I had it after my delivery. I nearly vibrated off the bed. So all of those things can cause shaking. Is there anything that can be done about it? Not really, because your body, it's not shaking because it's cold, it's shaking because of all of those things that we talked about. So you can do a warm blanket or some fuzzy socks for comfort. The one thing that I have found that helps, this is a tip from a really, really, really old school nurse, is to take a nice warm blanket and wrap it right around your head, your ears, your neck, and your shoulders, and just snuggle in. For some reason, that seems to do the trick sometimes, but again, this is more of a wait it out sort of situation. The sixth thing I really think you should be aware of is the nausea and the vomiting. And I did not even want to put this on the list because let's be real, nobody likes vomiting, like absolutely nobody. And nobody wants to talk about it either, but it's really, really common to feel nauseated or to throw up in your C-section or after your C-section. So let's chat about it. Why does this happen? The number one side effect of a spinal is a drop in your blood pressure. And if that drop is severe enough, you're going to feel nauseated, lightheaded, dizzy, and you might throw up. Another reason you might feel nauseated during your surgery is actually the stimulation of what they are doing inside your body surgically. So how can we fix this? If the nausea and vomiting is caused by that change in your blood pressure, we can fix it pretty easily. We can give you fluids, make sure you're positioned well, and we can give you lots of medications to bring up your blood pressure or medications for the nausea itself. So that's more of an easy fix. If you are feeling nauseated because of what they are doing in your middle, there's not really a lot that we can do about that except for maybe a cold cloth in the operating room and having somebody there reminding you to take deep breaths and that it will all be done soon. Because you want your baby out, but sadly it may come with nausea and vomiting. While we're chatting about nausea and vomiting, another reason people feel nauseated post-operatively is that they push eating too quickly. There is a reason that they recommend clear fluids following your operation for a set amount of time. If I were you, I would stick to that because you do not want to be throwing up a Big Mac if you eat it too soon following your operation. Super secret number 7, you're not going to feel pain for your surgery, but you are going to feel things. And that is because the goal of the anesthetic for your surgery is to take away pain sensation and sharp sensation and pinching sensation. But there are lots of other sensations that you will still feel during your surgery. Things like touch and pulling and pressure and shortness of breath. You will feel those, and there are certain points in time in the surgery where you're going to feel them more intensely than other parts. You're definitely going to feel a very strong pulling sensation when they go through your muscle layer because they are manually separating that layer. And you're going to feel a ton of pressure and shortness of breath when they are pushing on the top of your uterus for you to have your baby. The things that I always think about is someone once told me it felt like somebody was doing dishes in their abdominal cavity. So keep that in mind that it's not going to be a feel nothing situation. You will still feel things. That leads us really nicely to thing number 8. It's the elephant on your chest. What do I mean by that? What I mean is, people seem to think when you do a C-section, you make a cut in the skin and the baby just sort of floats right out. That is not at all what happens. I want to be really, really clear. Somebody has to actually physically birth your baby, and that is done by pushing from the top and pulling from the bottom. When we talked about that you're still going to feel that pushing and that shortness of breath, this is what I am talking about. So when it is time for your baby to be born, somebody will be at the top of your uterus on the outside of your abdomen, and they will be physically pushing down on the top of your uterus to push your baby out of that incision as somebody else guides them out of the incision. So you are going to feel a ton of pressure at this point in the surgery, and I just want you to be aware so that you are ready for it when it comes. And the last thing on our list, did you know that you're not allowed to lift anything over 10 pounds until you're cleared to do so by your provider? And this could take 4 to 6 weeks or even longer if your surgery was more complicated than a standard cesarean section. But this kind of makes sense if you think about it, because if you are lifting and twisting before your body is ready following major abdominal surgery, you could really do a lot of damage. But on the flip side, I did some research. The lightest car seat I could find was 6.7 pounds. So unless your baby weighs less than 3.5 pounds, which I am really guessing it probably doesn't, then you're going to go over that 10-pound weight limit quite easily. So this might be a really great opportunity for you to lean on your village, lean on your family and friends, or just kick back and let everyone else do the heavy lifting. So if you are pregnant or you are already scheduled for a C-section, I hope that maybe you were already aware of some of these things. And if not, I hope that none of them spooked you too much and that you feel a little bit more prepared for your surgery now. If you like this video, go ahead and give it that thumbs up. I had a great time making it for you. And if you've been enjoying what you've been learning, go ahead and hit subscribe. Check out some other videos like this one that you might enjoy, and I'll see you in the next one.